Well, if you're concerned about the coronavirus right now, you probably fall into one of three categories. The first category would be those who just have worry, and I think right now we're all worried about, could we have been exposed, or do we have some risk? If you're well and you're simply worried, we ask you just to stay home, stay abreast of information on the news, and you don't necessarily need to seek any treatment. The second category of folks are those who have had some minor illness that maybe they wouldn't have already gone to see their doctor about previously, before the coronavirus issue ever came up. And for those folks, we have plenty of avenues of contact. We would ask that you contact your physician or contact your provider to ask questions if you have any concerns. But most of those individuals will be able to, as long as illness is mild, to stay at home and do quite well. And then, of course, there are those individuals that are very severely or significantly ill, and in that case, you should definitely seek care, whether that's in an urgent care setting or if severely ill, you really need to head to the emergency room to be seen. So what can you expect from King's Daughters? We are in very close contact with our state agencies in Kentucky and Ohio, and that is rapidly evolving. We also follow the CDC guidelines very carefully, also rapidly evolving as the virus itself is beginning to show itself in different areas. We are providing quite a bit of education to our staff and to our providers about what to do when you encounter someone who is ill, what to do if you yourself are ill. Should you come to work or should you stay at home? We've actually provided some education to our providers as well about handshakes, something that is traditionally thought of as just second nature to many of us, myself included. We're having to back away from that practice for right now. Hopefully that does come back, but for now we're saying let's hold off on handshakes and offer another type of greeting so that we can limit the type of contact that could pass the virus on to someone else. We have been asked quite a bit about visitors and about masks. First, I'll address the mask issue. So for masks, we are asking that if you are ill, it probably is a good idea for you to wear a surgical type mask so that you prevent droplet and aerosol spread of any illness that you may have. We've also looked pretty seriously at visitor limitation as far as hospital and long-term care facility for that matter, and we have put some limitations in place to help limit exposure. So there are definitely things that we can do as patients and as members of the community to help us prevent the spread or prevent even contracting the coronavirus. The first thing is to remember that we don't want to forget about all those things that are out there right now, like the flu. So if you do need your flu vaccine and you haven't received it this flu season, it is never too late, and it is not too late to get that now. Those are available at multiple locations, including all of our clinics here at King's Daughters. So please take advantage of that. Also, if you qualify for the pneumonia vaccine, then we do have those as well, and you should take that. Now, to determine whether or not you qualify, I'd ask you to contact your provider about that, and we can have those conversations with you individually to see if you do in fact need that vaccine. Also, it's important to remember to take good care of yourself, get good rest, eat well, drink plenty of water. Make sure that you avoid large crowds if you can. Make sure that you wash your hands well, and there are certainly some guidance on how to wash your hands, and I would encourage you to look at the multiple resources that are available. Even the CDC has some resources on their website about how to wash your hands and use hand sanitizer properly. There are right ways to do that, and then there are wrong ways to do that. Make sure that you also practice the avoidance of handshakes right now. Make sure also that if you cough or sneeze, the best way to do that, it does happen from time to time of course, is to use a clean tissue, dispose of that tissue properly, and then practice good hand hygiene as we mentioned before. Wash your hands with soap and water or use the hand sanitizer. Another thing that is very commonly seen is folks touching their faces. I'm guilty of that myself, but try not to touch your face. That is a main way of transmission of the virus. We contract it on our hands, and by touching our face, we bring it closer to our respiratory tract where it enters our body and begins to infect us. It is important to disinfect hard surfaces, those areas that are most often touched by individuals. There are definitely ways to do that. We have products available to you that you can use to sanitize those surfaces. So you're talking about keyboards, light switches, remote controls, telephones, things that are always being touched. I know here at the hospital that is a major focus where we're cleaning door handles, cleaning off elevator buttons and many other surfaces, handrails, where we know that there are lots of folks touching those areas. Finally, that it's important right now to remain calm. There are a lot of folks out there who are working to provide great care for those individuals who are ill and to stop the spread of the coronavirus. If you have any medical conditions, the best thing for you to do is just to stay home and avoid things that are not necessary for you. Avoid large crowds if you're able to do so, and just make sure that you take good care of yourself.